Hello, welcome back. This is our eighth audio, and we will be actually talking about why the old strategy of medical practice that works so wonderfully for last so many centuries has suddenly become inactive. So we'll see how things have changed. There are four components of the system. Each one has changed. We will go a little bit into that detail. Now, for those of you who have already sort of got convinced that you need to move away from symptom treatment to something else, this audio may be a little bit of repetition, but I think I have brought out few facets of the problem that you may not be aware of. Yeah, so let's get going. Yeah. So first of all, I want to clarify that per se I'm not against allopathy at all. I have deep respect for the medical science, and allopathy is actually first medical system which can be called evidence-based. So that methodology I have full respect, and many times I'm going to say ki what doctor says is not correct. So this is not out of any disrespect for the doctors, and not as a community. There are going to be exceptions. You may be very lucky to have some excellent doctor who is having all the abilities and different capabilities that are needed to be a good doctor. So this is not on a personal level. As a system I'm talking about, and as a system things are going from bad to worse. That I have no doubt in my mind. There will be many exceptions. Maybe we may differ on figure. I may feel 10% are good. You may feel 30. That doesn't matter. If you are lucky to have a good doctor which satisfies the criteria that I have laid down in the overview, what qualities the medical practitioner should have. If he has those qualities, great. Yeah. So this is not about blaming anybody also. This is not a blame game. In fact, any blame is to be apportioned. I think we as a consumer must share the biggest blame. And why? We will come to that. Yeah. So first of all, this is not against any system. Just that the things have changed and the system will have to change. It is taking time. It will change in the end. It will change because it is based on science. So it will change. But it will take time, and we don't want to wait for that because we won't be there when the system changes. I'm also going to make at the end one audio on what I feel, what will be the future of medicine. And in my mind, I have absolutely no doubt that ultimately artificial intelligence will completely take over the diagnosis and treatment plan. Only execution will remain for human beings to do. And there will be very little error at that time. Yeah, but that's quite far away. Few decades probably. So if we look at the history or evolution, the biggest lesson is that all the systems, very powerful, like Roman Empire, or our own kingdoms. China had many kingdoms. We had many kingdoms. Very powerful empires, cultures, systems, all of them decayed. Yeah. So why did they decay? Do you think that the capability of Romans went down? They became not bothered or something? No. The army power was their strength, and it always remained. Things changed. Things changed in a sense that the things that were very powerful and useful at one time were no more that useful. You require different set of skills, and therefore the earlier ones, the system which stuck to their own set of skills, did not survive. Something new came up. Same thing about evolution. See, evolution, this wording that evolution is all about survival of the fittest, that wording is very, very unfortunate. Evolution doesn't mean survival of the fittest at all. I mean, partly yes, but this is not a full truth, and that has given misconception about evolution. We'll surely talk about it sometime. About genes and evolution, I do want to talk in little detail, but later on, so that only those people who are interested in those topics will listen to them. Others need not. So we will do it sometime. So flexibility and adaptability are the keys for survival. And same thing, you have to change because things change. And if you don't change with that, then you are doomed. Yeah, that's what happens. And that's exactly what has happened to medical system. Medical system came out with inventions and a system of treatment which works so wonderfully for earlier times. Why did it work so wonderfully? Let's see. because that system was based on triad of medicine, technology, and knowledge. And the purpose was to remove the cause of the disease. So germ was discovered to be a cause of infection, so you treat the germ. And that made sense, right? I mean, you remove the cause and you are rid of the disease. Now the technology part and knowledge part is still valid. It is in fact become better than what it was 2 centuries back. But this focus on removal of cause, that has completely disappeared. Why has it disappeared? Because the new diseases, the cause is very complex. It's not easy to determine. There is no one cause. And another thing is the medical system has no solution for the cause. They have no medicine for the cause. They had medicine for the germs in terms of antibiotics. But they have no medicine for the cause. So what did they do? Instead of telling people that, look, these diseases cannot be cured by medicine, so you better take care in some other way. Instead of that, they focused on symptoms. And that's how it has been going on. And I'm not saying they did it intentionally, but just think, it makes such a great business sense, isn't it? Because you have some contagious disease or infection, you come, a doctor gives you some antibiotic or some medicine, you go back, and you don't come back to him at all for that disease because you are cured, right? After 1 week, 2 weeks, when the medicine effect is all done, then there is no more the infection, and you get along with you. Now, this, how much can you earn out of this? As a business sense, I mean, as a business model, what you want is, you want a customer who will keep on coming back to you, either for different reason or best is for the same reason. Because then he's a lifelong revenue stream for the doctor. Now, again, I'm not saying that doctors did this so that they can get a lifelong revenue stream. I'm not saying that. But when they saw that this is what is happening, it's very difficult to resist the temptation and say, oh, this is not the way they should be done. Yeah. Now let us see what were the diseases earlier. What the 3 main reasons why people were dying a few centuries back, 2-3 centuries back, till 2-3 centuries back. The main reason was infectious diseases like cholera, TB, polio, plague, malaria, smallpox, chickenpox. Some of them may not be very prevalent in US, but these were all diseases very much prevalent in India. And if you get any of these, the chances that your immune system can overcome them on its own, and chances of your survival very, very, very poor. So till the antibiotics came into picture, or till you understood how the infectious diseases spread and you learned how to cope up with it, that's what we are doing right now also, right? There is no solution. So we are following social distancing, mask, all that. But its use is limited. You can't go on like that. So when the antibiotics came, we practically got rid of all these diseases. Smallpox, in fact, is completely eradicated. There is not a single case. Even polio is practically, very small level, right? Then the second reason of the mortality was absence of any modern techniques. That was very much important in childbirth. See, humans have a very problem. Our brain to body weight is very high, and ultimately, at one stage, in the journey of Homo sapiens, we kept on growing our brain, and the limit was what? The limit, why brain stopped growing beyond that point? Because beyond that point, the head becomes so large that it cannot be taken out of the vagina. So that put a limit, that brain cannot grow anymore. So now how we evolved is, we sort of had a raw material shaped in the form of brain, but its development, especially its development of its higher brain, took place outside, after birth, That's why, as compared to other species, humans at birth have practically no survival skills. In other species, you see a cow or cat or dog, within a week they start getting, I mean, they are on their own, and they survive. Humans cannot do that because our brain development becomes outside. Yeah. So anyway, that little bit of digression. So then we developed good techniques for childbirth. We developed a technique of surgery. So if you fall and break your knee or something like that, or your heart is having some defects, it could be repaired. That's a great discovery. It saved a lot of life. And then the technology helped, all the scans and on all the diagnostic tests. It could tell you beforehand, okay, what is wrong with you and to what extent and what part is wrong. In scans, you could actually see what part has got damaged. So all these technology advances, they helped bringing down the mortality very much. And finally, the basic concept of hygiene was not there. So till the germ theory emerged, people didn't know that these things which you cannot see are there in your water and everywhere, and they are very harmful. Once this became known, then so the diarrhea, it's so surprising that diarrhea, today it is difficult to imagine that people used to die in large number out of diarrhea simply because the water was altogether dirty, right? And we didn't know that the water has to be treated or you must drink only clean water. Yes, so these were the three main reasons why people used to die. And science and allopathy did excellent, commendable job in all these areas. But you notice that in each of these areas, they attack the root cause. Yeah. So there is a fault with the heart, you repair it. If there is a fault with the water you are drinking, you make people aware of it, how to take care of that. So infectious disease you get. So everywhere the root cause was attacked. Symptoms were not what they were treated. Right? So it worked wonderfully well, and it was like a miracle, and that is the reason why people develop so much confidence and trust and awe and respect to this medicine, which is well deserved, right? Now look at the new set of diseases that we have today. What do we die of from today? Cardiovascular diseases, stroke is the biggest, cancer is the second, diabetes, obesity, high blood pressure, Alzheimer, liver, kidney failure. TB is the only thing that is still remaining because medicines are not properly taken or is not getting detected in time. But you will see that out of 10 main causes of mortality, 7 out of 10 belong to metabolic diseases. And in these all metabolic diseases, attacking root cause is something that medicine could not do because they had no solution. Yeah? So that is the main difference. This is just a chart where you see in 100 years, the mortality per 100,000 population in US. Again, this is data is about US because that is what is easily available. Indian data is, I try to search, it's not reliably available. So if you look at it from 1900 to current time, 120 years, the data is only up to 2010. You will see that the mortality rate has gone down from 1,100 to nearly only 600. That's almost half, right? And the average age has also gone up. So that is fantastic, isn't it? It's fantastic. But then look at the diseases. See, look at where cancer and heart disease, how much part of that 600 deaths is taking away. And look at 1900, there are no recorded deaths for diabetes. Yeah. Diphtheria and senility and these are there, but not much of diabetes. And cancer and heart disease are of course there. They are always going to be there because I had explained to you earlier, they are also a matter of chance. These mutation occurs in cancer, even in people who are perfectly healthy and taking all kinds of precautions. So, but see that 100 years it has more than doubled and is more than tripled actually for cancer, 64 to 185, and the rate is still increasing very fast. Diabetes is really frighteningly increasing very fast, and that is known cases of diabetes. How many of pre-diabetes we don't even have any clue. Yeah? So that is how the picture has changed. Now let us. And so you have already explained what is different about these metabolic diseases. They are not contagious and root cause is not attacked. Now, so let us compare the old and new. So I have put many factors, and let's go into each of it. And I think this is a very good. I feel it's a very good analysis which will give you insight. So consider cause and effect relationship. In old, the cause and effect relationship was simple, 1-to-1. This particular type of germ, this is the cause, this is the effect. Yeah, that germ will differ, or you're not having this surgical procedure available. So you knew the cause to effect relationship, and it was very simple, 1-to-1, and the cause was treatable in old system. In new system is multifactorial, very complex, requires great deal of skill on the part of the doctor to make a proper diagnosis, because same symptoms could be there because of different reasons, and you have to look at whole overall picture very carefully. Earlier it was not like that. I mean, you do analysis and you saw this germ is there. So in terms of skill required, doctors required very small amount of skill, and once you know what germ is causing the problem, then it hardly required any skill to say which medicine should be taken. Yeah? So multifactorial thing, very complex, and no medicine. Then the mechanism. This is very important. Mechanism was in old cases non-personal, person specific. That means if I get the germ and you get the germ doesn't bother about what is my metabolic state, what is my genetic structure, what food I eat, do I sleep enough, whether I sleep enough or not, whether I have stress. All this was not very important once you get infected, or once there is no surgical treatment, or once you have an accident, right? So this was non-person specific. Therefore, again, the treatment was easy. Because once you come as a patient and I say that, okay, you have got say symptoms of TB, then the treatment was common for all. No, or you have fever, then crocin. I mean, I don't have to ask you, is there any history of fever in your family, and what do you eat, and what work do you do, are you stressed? These questions are not needed to be asked in old diseases. Whereas in these new diseases, it's person specific. The doctor needs to know a lot about the patient. He needs to know about his lifestyle, his thinking, whether he's getting stressed, what he eats, everything, and then only he can really suggest a solution. Now, where does the doctor have time? He will have to spend 3-4 hours to actually get all the basic information from you. And many people may not be able to tell the proper answers. So it's a very difficult job. So person specific, and therefore now who knows yourself best? You know yourself best. That is why you should be able to make a judgment better than a doctor, but that is if you have a knowledge. And a doctor without knowledge, or even doctor with knowledge, is not as good as you yourself with at least basic knowledge. That's why I keep on insisting that you must know the basic knowledge, and then you will be able to know what is wrong with you and make proper lifestyle changes. So point of attack, again we have talked already, that point of attack in old system was root cause, point of attack in new system is just treatment of symptoms without bothering about the root cause. Now let us look at the researchers. Now, who found that these germs? Louis Pasteur found. Did Louis Pasteur have a very big organizational backup with lots of facility? And no, look at all the inventions earlier were person specific. Galileo, or person Harvey, who found out how heart works, or Louis Pasteur. All these were very dedicated, highly intelligent people who were not doing it for money. Yeah, and they were honest. Now the research has shifted to corporate. So you require hundreds of people in a team and good interaction between them and so many regulatory processes, and then you will come out with some complex procedure to evaluation, and this takes too much time. And what about honesty? I would not like to comment on it. You can form your own opinion. My opinion about this organized corporate sector is as bad as it can be. I think money is the only thing for them, and it's inevitable. I'm not blaming the corporate. We have chosen a capitalist system, and it has its own benefits and its own faults. As far as the ethical standard of society is good, the faults don't reveal themselves, because there used to be a line which a corporate won't cross, Tobacco was the first instance when very clearly the industry crossed all the boundaries in terms of ethics. See, smoking causes cancer is something got established by outsiders quite late in the game. And afterwards, many people sued all these tobacco companies and got big compensations. Do you know why they got the compensation? They did not get the compensation because they got cancer because of smoking. No. They didn't get it because of that reason. Because that is not fault of the company. If they also were not aware of that, then they can't be blamed, now they can't be held responsible because they are advertising that is injurious to health. Beyond that, if you take, then it's your own responsibility, right? So they had to pay the damages, not because they were not knowing. They had carried out the research and they knew fully well how smoking was dangerous. And they did not reveal this research. So they were found guilty because they knew and they did not tell about it. Yeah, that is the guilt point, not that it turned out to be bad. Yeah? So honesty, like now say manufacturers. Now earlier there was not much mischief that you can play in say antibiotic. I mean you can play a little bit with chemistry. Quality, but not much. Some kind of quality control will show whether. But now the medicines have become also very complex. Then there are so many combinations and many medicines are there. We don't do anything actually. They just depend on placebo effect. And companies very gladly keep on producing this. So the researchers' honesty we cannot vouch for. It is going down. Now I'm not saying everybody is a bad guy, but the good guy doesn't survive in the current corporate structure. You just look at the hospitals, how they are run. So most doctors now, instead of private practice, they prefer being attached to hospital. Now it's an open secret, at least in India, that just like you give target of sale to these salesmen who go to from doctor to doctor and tell them and give them free samples, is that just like that these doctors have a target that you must prescribe so many patients per week for this scan, that scan. Doesn't matter if the patient requires that scan really or not. So now tell me, then if you are like that, then how many doctors have sufficient courage to quit corporate sector and practice on their own? Not many. And don't blame them. This is how the society is working, and when the whole society is sort of infected, it's not possible that a small part of it will remain very, very healthy. So don't expect the doctors to be very honest and ethical when the whole society is going in totally wrong direction. How many doctors, now another open secret, every doctor actually, practically, unless he refuses, gets a cut in the all these pathological tests that they prescribe. They straight away get a cut. If you send a person for scan, if doctor sends a person for scan, he gets a cut out of that. Now what is this? Will it not promote unnecessary prescription of drugs, of tests and scans and everything? It will. In most cases it will. There will be honest doctors. So manufacturers, I won't call the doctors evil. No, they are good people who have been forced by the system to become bad. Manufacturers, I would call evil. Most of the pharmaceutical companies are evil. Now, of course, they are doing good job. They are also producing lot of medicines which are helpful. But that is because their interest and our interest as consumers coincide. The moment our interests don't coincide, if their interest in opposite direction, they take care of their interest and not the consumer's interest. Again, largely it happens like that. Regulators, same thing. Earlier regulators were far more strict. Now the regulators are being funded by corporate sector. Now, how can you expect them to have integrity when their funding depends on corporate sector? Also, their job has become very difficult. Now there are so many factors, confounding factor to really figure out whether some drug is effective or not. Is not an easy task. It was very easy to figure out whether taking penicillin solve the problem or not. You have 90 patients and 98 patients will become better. So there is no doubt at all. Complexity of the evaluation procedure has also gone up significantly. So regulators also, I really don't trust if FDA says that this vaccine is safe. No, I don't trust them. Does it mean that everything they say is wrong? If they clear 100, all 100 are bad? No, I'm not saying that. Very difficult to judge where they are making a good or not good recommendation. Look at who was. I had such a respect. I mean, we all had such a respect for who, his organization. Now, look how many blunders they have made in the treatment of COVID. So many things they kept on saying. The very first thing they insisted for quite long time that it cannot be transmitted from person to person. If they had not made that statement, probably we would have started in a right direction. Yeah? So that is the way it is now. Kind of doctors, earlier we had a family doctor system. The family doctor knew everything about. Now everything means most of it he knew. He knew your family background. He knew type of person you are, what you eat, everything. Now it's not only corporate, it's impersonal. In 90% of the cases when I go to a doctor, I don't know him, he doesn't know me. All he knows is a piece of paper which gives information about my pathology test. And I'm going to talk about how absurd is the way they analyze this test and give the solution. So it's a bigger, it will take some time, so I will not talk about it right now. When we come to test, I will show you what is the right way of analyzing the test results and how the way that is followed. Now look at the knowledge required. Earlier, knowledge of anatomy and medicine was enough to treat all these, because he didn't have to know a lot about the germs and how that antibiotic works and all, right? But now the doctor needs fantastic knowledge of biochemistry and nutrition, because biochemistry and nutrition are the foundations of all metabolic diseases. So what percent of time of their total career are they taught biochemistry and nutrition? Practically zero. I think I'm told that there is one term course on nutrition biochemistry which everybody gives for a sort of an option or just forgets about it, and that is the main thing they are dealing with, right? So they simply, so this your concept, that these are experts is not true. It's not true as far as metabolic diseases are concerned. Maybe they know how to bring down the sugar. I'm not challenging that. Also, I feel that the medicine given are not the correct one. In the long term, in the short term, they are all of course correct. But they are definitely not experts in biochemistry and nutrition. Again, not their fault. Please remember, this is not a blame sharing or blame apportioning game. It is not their fault. They are not taught these subjects. So how do you expect? You tell me, say, what is happening, there is you are playing cricket and you have a coach and he teaches you how reflex are important and how stand this and then how well you connect shoot with the bat and how you should hit it so hard that it goes for a 6 and you are hit the best shot in the game and you get 6 runs for that, right? Now suppose now you want to change over to tennis and you bring the same fellow and he is not aware of the different rules of the game. Still 90% of the skills required to play good tennis and good cricket are same, right? You need good reflex, you need good outside, you need good anticipation, you need good strength, and you need to connect the ball with the bat. So a lot of things are same. So you say, okay, what is there? He can teach me, but then he doesn't know that if you hit the ball with all full strength and high, then goes out of court, and instead of you getting 6 runs, your opponent gets the point. That's it. So his skill is a different game, right? So you can't have the same person advising you unless he learns the new skills. If he learns the new skill, great. Then he's even a better person, because now he is skilled in cricket also and in tennis also. So now he has more points of expertise and he can connect the dot better. Connecting dot better is something what again I keep on saying. That's how that you should be able to look at the same problem from different angles, so that that you come out with a very good insight. Now, eating habits. Earlier people were using homemade whole food. Now we are just going to hotel and eating processed food and nutritionless food, and doctor has no control over it. And if there are good doctors who try to tell patient that don't eat this, how many people listen to them? Instead of changing the food, they change the doctor. Very simple, isn't it? So finally, the patient. Now patient had a totally passive role earlier. He didn't have to know anything. Anything means anything. Right? He didn't have to know how paracetamol works, or how antibiotic works, or how bypass surgery needs to be carried out, or how dialysis works. He didn't have to know anything. He goes to doctor, tells him what is the symptom, and he pays him, he gets medicine, and that's it. Now, in case of these lifestyle diseases, patient is the person who has to take charge. He is the person who has to deliver. He has to person to who has to make changes, and therefore for doing that he has to understand the disease. So the focus or the responsibility of knowing the disease and deciding what to do and actually doing it all has shifted from doctor to patient. Yeah. So that is why the way the whole thing is to be treated is completely different. So patient knowledge earlier hardly needed. Now the knowledge that is needed by patient is very much there, because you can't outsource it. Now this is a temporary problem. As I said, that science keeps on changing, medical profession will keep on changing. Ultimately, as I said, artificial intelligence will take over, and at that time again we will go back to the condition where you don't have to understand, but still execution will be up to you. No, the AI will be able to tell you that this food is not good for you, but actually you will have to stop eating that food. So the habit change is still ultimately going to be up to you. So this is a big difference. The focus has to be shifted from the supporting system to yourself, and there is no alternative to knowing the science, because you will have to make decisions and implement them. You cannot outsource this, because there are no capable people to whom you can outsource this problem. Just pay them. So this earlier system, we started believing that all I need to do is hire some good person and pay him, and that's all. That impression now you please get rid of. Understand that you are responsible, you have to do it. So factors that are involved, I think we have talked quite a bit about this at some earlier thing also. So I will just read through that genetics, epigenetics. Again, genetics, epigenetics are not taught largely unless you become specialized in those fields. Stress level you need to understand, and again, doctor cannot rid you of stress. You have to rid yourself. Sufficient sleep, balance and appropriate diet, exercise, sedentary lifestyle. So these are the changes you will have to make, and the willpower. So all these factors you will have to take into account and make suitable changes. Now, for that, what you need? Doctor, I have in the overview I have given list of many qualifications that the doctor needs to have, and that time you might be wondering as to why should he be understanding psychology, and why should he understand logic and all this. So probably now you are getting little better idea of how these fields are important. At least the basic knowledge of that the doctor must have. Nutrition, exercise, biochemistry, psychology, and in the end, after having all this knowledge, he must have lots of time. Because look how much time I am spending with you in making you aware of even just fundamental things. Much more than that is the time that the doctor will have to spend with each patient. If he wants to convince you for making changes and then hope that you will make the changes. Can any doctor have this kind of time? He cannot. Because today he pays you, he gives you only 5 minutes, 10 minutes. You go to cardiologist, he will just say, okay, this is your stress test result, this is your 2D echo result, these are the medicines you are taking, and these are the pathology report. Now you continue, or we'll make these changes in the medicine. You see me after 6 months. That's it, 15 minutes, 2,000 or 3,000 rupees paid. Now, if he has to spend 3 hours with you, mind you, he must be paid some 25,000 rupees for his time, right? Are you going to pay that? You are not going to pay that, because our psychology is, after 3 hours, in the end, he says that, Arvind, I cannot give, I don't want to give you any medicine. You make changes in yourself. First of all, I will say what shit, what I get out of this appointment, and why should I pay him so much money for telling me that he can't do anything. Yeah. So it's a tough job. If you can get such a doctor, fantastic. Now new branch is coming up actually, called endocrinology. So because that deals with hormones, and all these diseases are based on hormones. So if you become sort of feel that your hormonal imbalance is there, and you make it one of these diseases, you won't go to diabetologist. You will go to endocrinologist. So endocrinologist will tell you how to get your hormones back, and by making changes in lifestyle, everything. And if he cannot succeed and you say, no, I want to take medicine, then for medicine you will go to diabetologist. That is how the system will work. And that's a little better system. Yeah. Go for prevention is my advice, and take care of other factors also. So finally, I have just listed out my background. I consider it's quite unique. The amount of time I have spent last 15 years is unimaginable. Every day I spend many hours in studying all this for so many years. No doctor, nobody. I don't have, it's a unique in so many senses. I don't have family responsibilities. I did have interest. I sacrificed them for learning all this. So amount of time I have put into this is simply unbelievable. And also I knew about genetics, I knew about biochemistry, so didn't have to learn everything from scratch. And so many fields knowledge, I could, as I said, I could connect the dots. Now I also sending along with this a list of my academic qualifications in this field. I have excluded my 3 master's degrees in other fields, like in chemical engineering and in finance and all. I have also excluded all the courses, diploma courses I did, which are sort of not very well connected with health area. Even then, some 16, 17 courses are left, which I feel are suitable. I mean, they give you a lot of clue, and they teach you quite a lot about these metabolic diseases. So again, so Bogani has raised a point, am I showing off? So am I showing off? No, I have least interest, because I didn't do these courses to tell anybody. In fact, very few people knew I did so many courses, right? So if you are happy and convinced that doctors cannot solve your problem, and I can partially help you at least in enabling you to get idea about what you should do, then please don't look at the file, because don't have to know what all I have done. Yeah? But if you're curious, or if you feel that you need a little more data to make up your mind, then have a look. And probably when you see kind of diverse fields, I have had a chance. I'm lucky actually to get acquainted with. Has really helped me in looking at the disease from all angles. My experience in running a factory for 5 years made me practical. Otherwise a typical scientist from NCL, he has zero connection. I mean, very little connection with reality of life. And things involving practicality and cost and all this. So I learned quite a lot of that. I don't have, frankly, very good opinion about teaching ability of professors in IIT. But one thing IIT taught me, for which I am very grateful, is that they taught me that knowing fundamentals is very important. And if you know your fundamentals well, you can derive everything in steps and come to a right solution. Don't need to mug up, or don't need to read. So basic principles, and then how to derive the solution from that. It taught me that. So basically I did all this research for my own purpose. Then I got interested and started learning about things that I did not have any problem.